My name's Larry, I'm a physiotherapist at Upright Care, and I wanted to give you a basic recount of our recent workshop on exercising correctly when you have pain. So we did a brainstorm with our group on what is pain, and they felt there were many different kind of descriptions of pain. It's stress, it's pain, it's discomfort, but it has profound psychosocial impact as well. It creates loneliness and depression, anxiety, lack of movement. They feel, alone with people with chronic pain. So when we looked for a description of pain, Professor Lorimer Moseley said that pain is an unpleasant feeling that is felt somewhere in the body and urges us to protect that part of the body. He also then said that pain is an output and not only an input. So we need to look at the integration and the description of what happens in the mind and how that correlates with pain. So we went through different pain behavior scenarios, and we described that exercise is one of the most important ways of managing pain and chronic pain, and that it's very important to keep on moving, but you need to keep on moving wisely. We learned about rating pain, so people can rate pain from 0, which is no pain, to 10, which is an extreme amount of pain, and how to quantify your pain at each particular moment in time. So it's important to find out how your pain is doing now, and also whether or not it gets worse after any form of exercise. So the general rule is that you should be able to exercise as much as you comfortably can. So if your pain is at a certain level, once you exercise, you can tolerate or allow yourself to increase pain slightly by 1 or 2 points, but then your pain should drop down back to your baseline level. So if your pain is normally 5, you can push yourself till your pain is 6 or 7, and then it should go back down to about 5. You also want to make sure that the following morning, when you start exercising again, your pain is again at 5. What we don't want to have happen is your pain starts off at 5, it goes up to 5 or 6, and when you wake up the next morning, your pain is 8 or 9. That means that you've done too much exercise and you've pushed yourself too far. It's very important to work with your therapist, with your physiotherapist, with your doctor, with your medical practitioner to help you to achieve the different goals of exercising with pain, because you don't want you to overdo things, but of course we don't want you to underdo things, because then there won't be much resolution of your pain. Your joints need to move. They need to move in order to lubricate. Your muscles need to move in order to kind of get things going, and you'll find that will increase your quality of life. We also learned from Amy Peek, who's one of our expert physios who deals with headaches and neck pain, about the origin of headaches and how there's many. I think she said there were 150 different descriptions of headaches, and how your neck and the pathology around the neck can contribute to headaches and ways of dealing with that. So if you have any questions, email us directly. We're happy to answer them. If you want to come to the clinic for an initial discussion, we're happy to help you out with that as well. Anyway, thanks for listening.